Dr. Duke, you're a holistic doctor. Do you have lab work that is perfect but you don't feel well? Are you on a merry-go-round of supplements or medications and it's not helping? Why aren't you getting better? It's easy. Organ dysfunction. So what is organ dysfunction? Organ function declines over time due to stress, trauma, lifestyle, diet, bad luck, aging. And if the organ can't function right, you get symptoms and the chance for opportunistic baddies to get in, molds, fungus, yeast, bacteria. And therefore it stands to reason that optimizing organ function can improve the quality of life and resolve symptoms. So how does it work? Modern medicine assumes that all organs function at 100% all the time. The problem with that idea is we already know it to be untrue. Over time, due to the issues I mentioned, systems decline until the body can no longer function. We know people become deficient in enzymes. Think lactose intolerance in older age. We know hormones decline with age over time, such as low testosterone in men and menopause in women. This is why hormone replacement therapy exists. This is well documented. Additionally, labs can be misleading. We can only test what we are looking for. We laugh now at tests we did 50 years ago. And 50 years from now, people will laugh at the tests we do now. While useful, they only show the disease state of the body, not the organ's functional capacity. 90% of the patients that walk through my door have perfect labs but don't feel right. Or they have corrected their lab values with supplements from their doctors and have seen no change. So, why do we only treat symptoms or attempt to arbitrarily move lab values up or down? Modern and natural physicians simply see them high or low and then attempt to raise or lower these lab values. They never ask, why are these high and why are they low? And it's always because the organs simply cannot function optimally. They missed step B in treating the body. They start with A, your symptoms and labs, and then they jump to C, the medications in the case of conventional doctors, and a ton of specific supplements in the case of natural physicians. They never address B, which is the ability of the organ to do anything with what you are giving it. It's akin to attempting to have a fast car by using jet fuel but driving a rundown car from the 50s. The car isn't going to go very fast. But if we put in Ferrari parts, i.e. optimize the organ function, then the body will be able to do something with everything you are giving it. Again, don't skip step B. So why is this all missed? We have to remember that modern medicine is predicated upon the germ theory. One bad guy needs one good guy to resolve it. The body doesn't work like that except in cases of acute illness. The body is multiple organs working together to provide optimal health. And when one system is off, it is generally easy to assess. But when multiple organ systems are being impacted, the symptoms and labs are harder to discern. And then you can't tell what's going on. So if medicine is looking for a single boogeyman that doesn't exist, round and round you go. If your symptoms are based upon multiple organ dysfunctions, then they can be misconstrued as anything. As they pile up, it seems to be unsolvable. But the whole time, it's symptoms of the organ just not working right. Think of a car dashboard and engine. The dash is just indicating a problem in the engine. Labs are the dash, and the engine is your body. If you are arbitrarily moving those lab values up and down but not feeling better, it is like attempting to turn off the dash light. You aren't optimizing the engine. We need to do that first. I'll say this again. This is why conventional and natural doctors make the same mistake. They're attempting to go from A, the problem, symptoms, to C, treatment, pharmaceuticals, and supplements. But they skip B, which is optimizing organ function. So symptoms of this can vary organ to organ when there are multiple organs involved. All the symptoms can be different for a patient even if they have the same organs impacted. The liver can be headaches, brain fog, or floaters in the vision, or it could be skin conditions, digestive disorders, pain issues. So if you treat those symptoms but not the organs, you may never resolve the root cause and you will continue to suffer. There are 11 organ systems in the body. 135 metabolic pathways and millions of individual pathways for each organ, and they all need specific things to function optimally. By simply throwing D3, zinc, magnesium, and what have you at the body like natural physicians do, an approach basically like throwing things at the wall and seeing what sticks, you aren't going to resolve the organ's capability to function optimally. My protocols are formulated specifically to address organ dysfunction. I pioneered this entire way of treatment to give the substrate for the specific organs to pick and choose what they need to function at the highest level. The body knows how to do these things. It just needs the support when it is beyond simple lifestyle and diet changes to correct. When you do that, the organs begin to function as they should, and symptoms tend to fall by the wayside. Again, because the symptoms weren't a sign of some random disease, but signs of organ dysfunction. Remember the engine and dashboard analogy. It's true, there are underlying root cause issues, which I will discuss at another time, that do need to be treated. But without treating the organs first and foremost, you cannot treat underlying root cause issues. The body can't address underlying problems if it is incapable of functioning, and you can't circumvent that. This is why patients resolve hard-to-treat issues here in my office when they can't elsewhere. If you want to know how to really get healthy and optimize your health by addressing internal organ dysfunction, then hit subscribe below, follow, comment, call, text, email our office, and I can turn you into a new person by correcting organ dysfunction and true underlying root cause issues. Stay optimal.